Something that we see in the clinic every day and get a lot of questions about is tendonitis and what causes it and how can you treat it. So tendonitis is often from overuse or repetitive strain. So if you think about someone in the gym, for example, lifting incorrectly or overloading what they're doing in the gym, so that could cause inflammation around the tendon or tendonitis. Certain professions, such as a chef, chopping all the time, builders using hammers, tennis players. You can even have acute injuries such as falls, accidents that can create tendonitis. So tendonitis is where you have irritation or micro trauma to the tendon, and there's obviously a lot of inflammation around there. The body can't keep up with repair and you end up with quite a lot of pain and swelling around that area. Patients notice on certain movements or doing certain activities there's pain. Another example would be rotator cuff injuries or frozen shoulder. Sometimes you would have tendonitis or tendinopathies that are created there, and then you would have a reduction in the movement of the shoulder. So we would look at doing things where we're reducing and facilitating the repair of the tendons and the microtrauma around that. Some of those techniques would be cold laser, which is painless and really effective at actually improving blood flow and cellular repair. Shockwave therapy to help break down adhesions around the area to actually get better movement of the shoulder. We would use dry needling to help take pressure and pain away from the muscles that are either overused or underactive. Mobilization techniques, adjustment techniques, just to name a few of the ways we would treat tendonitis in the shoulder. Another really common one, and that we've all heard of, is golfer's elbow or tennis elbow. So tennis elbow, synonymous with not just tennis, but for example, builders using hammers and using repetitive movement or lifting problems. So you would end up with pain on the outside of your elbow, and to grasp things like grasp strength is reduced and lifting things is painful. So again, we would look at doing active release around the muscles in and around the forearm, doing some needling techniques, cold laser, kinesiotaping, and obviously some stretches that they can do at home to help reduce that inflammation around the tendon. So tendonitis, it's a very, very common problem, something that we see all the time. There's lots of different reasons it's happened, from trauma, like I said, repetitive movements, and so you see it with people in different professions, all walks of life. It's not just elderly people, it's not just young people, it's across the whole range of society, and something that's treated quite effectively as well.